Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Reform Advocacy, where we address problems in the healthcare system, then take actions to try and make the system work better for all of us. Good news, voters in Ohio, Kentucky, and Virginia decided yesterday, November 7th, 2023, that women's health and the right to abortion matter and deserve protection. Those rights deserve to be protected everywhere in the U.S. When people are targeted as unworthy of rights, democracy begins to die. When everyone has rights, democracy flourishes. It's simple. Okay, there's an action we can take to help promote those rights. But first, let me point out down below in the description section will be a link to a Healthcare Advocacy Newsletter that is the text for this video, and all the actions and links and everything else will be in there. Okay, so here's the action we can take related to reproductive rights. We need to take a moment to remind our representatives and senators in Washington, D.C. that we want those rights restored nationwide. There are 4 bills that address reproductive health care. We can call them or email them and let them know we want them to actively support them. Now let me point out the phone number to reach them and a link that will get you their email addresses will be posted in the description section. So let me tell you what the bills are. The first is H.R. 12, the Women's Health Protection Act to codify Roe v. Wade. H.R. 782, ensuring women's right to reproductive freedom. That's in case women have to travel across state lines, they get to do that, and providers are not penalized for it. H.R. 3420, the My Body, My Data Act of 2023. We already have it in Washington State, but you know what? Women's health care data is their data, and it doesn't get to be shared on an app, or people can't be trolling for it and figuring out you're going to get an abortion. So cut that out. That's what that bill does. And the Abortion Justice Act, H.R. 4303, which will actually help overcome some of the healthcare obstacles that so many have, especially for low-income women today, so that they can get an abortion should they need it. Okay, let me point out that all of those have companion bills in the Senate as well. Now, I will post this link in the description, but if you like, you want to do it right away, you can, on your cell phone, send a text to 50409, and all you have to do is type in SIGN, S-I-G-N, P-U-V-R-U-X, and it'll send an email to your representatives, all 3 of them, telling them to do that. If you've already taken that action, then I recommend you go back and call or email them, because let me share with you something I've learned being an advocate, is that representatives' offices, like congresspersons or senators, they keep track of people's opinions. They don't necessarily keep track of who's giving them the opinion. And for that reason, the more they hear over and over and over again support for a particular item, the more important it is for them to hear it. And they pay attention to the numbers. Okay, anyway, the phone number and email will be in the bottom, in the description box. How about some happy news? Let's talk about Parkinson's. There'll be a link to the Parkinson's Foundation. I read through a lot of healthcare newsletters this morning, and this popped up, and I really wanted to share this breakthrough with you. Let me give you some background on Parkinson's. It is a neurodegenerative disorder. It affects predominantly the dopamine-producing neurons in a specific area of the brain. It happens to be called the substantia nigra. Symptoms generally develop slowly over many years. The progression of symptoms is often a bit different from one person to another due to the diversity of the disease. People with it may experience tremors, mainly when they're at rest, slowness of movement, limb stiffness called rigidity, and gait and balance problems, postural instability. So what was the breakthrough? Well, it addresses the last one, gait and balance problems. For that, it becomes really hard to walk. You start and you stop, you're unsteady, you often fall. It is miserable. I had an uncle who had this, and he wound up having to use a walker all the time to move from one place to another. Balance and gait impairments are the hallmark symptoms of Parkinson's disease. They become increasingly prevalent as the disease progresses. That's not something at early onset. It usually shows up about 15 years after the initial diagnosis. Now, targeted spinal cord stimulation with an implanted neuroprosthesis, so a little device put in your back, helped a Parkinson's disease patient, who had severe difficulty walking without falling. This was in a proof of concept study recently. The patient was 62 years old and had had Parkinson's for 30 years. Actually, if you go to the newsletter and click that open, there's a photograph of him walking. He couldn't look happier. When he wants to walk, he uses a remote control device to send signals, something like this, to send signals to the stimulator to activate leg neurons. After several weeks of initial rehabilitation, he was able to walk almost normally. And 2 years after the implantation, he uses his device for about 8 hours a day, turns it off when he's sitting or sleeping, but he's able to walk regularly, several kilometers at a time. That's great. Anyway, there's a link to the study in the newsletter, and it's important. I think this is just tremendous as an advance in healthcare. Let's talk about universal healthcare update. Previously, we reported that there are a number of states trying to implement universal healthcare on their own, not the federal government. Individual states. Washington's trying, Oregon's trying. I think Vermont on the East Coast is trying. There are about 18 states involved in this. They're single-payer insurance trusts that will be managed by the individual states. You can call them one-payer programs. Public insurance paying private providers. Now, I include in the newsletter a map that I picked up from one-payer states, and if you click on the map, you'll get to their interactive version of it, and there are about 18 states highlighted in green that are moving towards one-payer capability, towards universal health care. And if you click on any of those green states, you'll see who the organizations are, what they're promoting. You'll see a link to the organizations involved in trying to get the legislation through their state houses. And you can get in touch with them and volunteer or get more information from them. Well, state-based universal health care is a good idea since it demonstrates how to implement a single-payer universal health care, and it stands a pretty good chance of passing at some state before the federal government. Now, it's not a free ride. If a state wants to implement such a system, they have to enroll Medicare and Medicaid people and federal employees and Tricare, that's military families and retirees. Got to get them all on the program. And employees of corporations, because remember, half of us get our health insurance from our work. So the states need waivers from the federal government to do that. The states also have to be able to have private employers offer that state-based insurance to their employees. They need a waiver for that too. That's from ERISA, the Employee Retirement Income Security Act. There also needs to be some coordination with the IRS because employers' payments for health insurance premiums are pre-tax dollars. It's an expense. And individuals like you and me, if we have to buy health insurance, we usually do it in after-tax dollars. So there's going to have to be some coordination on this. Anyway, Representative Khanna of California has grouped together all the waivers in a single bill. It's called H.R. 6270. It provides all the required waivers and exemptions in one act of Congress directed to each appropriate federal office for prompt action. And good news, the waivers do not sunset. Most times when you get a waiver from a government agency, they give you a terminal date. It's only for a specific period of time. These don't go away as long as the state's program complies with the following requirements. Coverage has to be for at least 95% of the state's population. All patients that are previously covered by federal programs have to enjoy benefits at least as comprehensive as the original, maybe better. Federal debt does not increase, so you don't cost the government anything. This bill, H.R. 6270, state-based universal health care, is going to need our help to make sure that our elected officials know we want them to act on it. We need to let them know this over and over again. So here's the action. Ro Khanna's bill, H.R. 6270, is going to modify federal restrictions on Medicare, Medicaid, ERISA, Tricare, and taxation, allowing states to create universal health care systems. Hold that thought. Then you can call our representatives. Here's their number, 202-224-3121, and urge them to co-sponsor and support. You can also, there will be links down below to a set of talking points if you like, or you could just use the text I had above if you want to talk to them. Anyway, that link will be there. Next, you can send an email to your representatives using single-click links from One Click Politics. Essentially, you just put in your name, your phone number, your address. It figures out who your representatives are. Click go, and it sends the email. It's from one-payer states. They do have a little button if you want additional contact. If you don't, uncheck the button. And then you can send messages to your congressional representatives and senators. And we can do this over and over again. That's the message for today. Like, share, and subscribe down below. Click on the Healthcare Advocacy Newsletter to subscribe and get this as a daily message in your inbox. Have a great afternoon. Thank you.